Hello, everyone. Welcome to the Integrative Nurse Coach Gathering webinar number 9. We have Holly Carpenter here from ANA. She will be speaking to us about how to cultivate nurse renewal. My name is Lisa Osler. I am the co-host, and I am also a faculty member at Integrative Nurse Coach Academy, as well as the creator and facilitator for Yoga for Nurses. And I'd like to introduce my co-host, Carly.
Hi, everybody. I am Carly Mertz, board certified nurse coach and nurse planner for INCA. And it is my pleasure to introduce Holly Carpenter. Holly is a senior policy advisor for the American Nurses Association, Nursing Practice and Work Environment Department, as well as ANA's Healthy Nurse, Healthy Nation program. Her portfolio at ANA includes developing resources, policies, and education programs on nurse health, safety, and wellness, including nurse suicide prevention, mental health issues, immunizations, climate change, and other occupational health and work environment issues. She presents nationally and internationally on nurse wellness. Prior to ANA, she was employed at Maryland Nurses Association and the State of Maryland's Department of Health and Mental Hygiene. Holly graduated from Salisbury University with a Bachelor of Science in Nursing. And now we're going to do a little awareness practice before we begin. Let's begin by taking a few slow, deep breaths at your own pace to come together as a community of like-minded nurses. Let us open our minds and give space for new wisdom during this webinar. And if anybody would like to put any questions in the Q&A at the bottom, we will get to them at the end. Okay, Lisa.
Thank you, Carly. Welcome again, Holly. I am really excited to get this time to chat with you. Nurse renewal and health is a huge passion of mine. So thank you for all the work that you do. So let's just dive in. What are some of the key challenges and stressors that nurses face in their daily work? And how does this impact their well-being?
Well, thanks for having me. We're just going to jump right into it.
We're going right in.
Well, I'm preaching to the choir here for certain. But as you all know, nursing is joyous and has so many rewards. So as we go through this list of things that are not so joyous, please keep that in mind. It is a calling that we've all answered, and it is a beautiful profession. But, you can't have your ups without your downs. And some of the things that nurses are facing now are no different than they were when I was a brand new nurse 35 years ago. So long hours, few to no breaks. Not everyone, but a lot of people are facing staffing shortages, which means heavier workloads, workplace violence, bullying, incivility, fear, isolation, and loneliness in respect to nursing issues, especially during during COVID when the vaccinations first came out. 90% of us are women, and the men also would have family stressors and caregiving in the family when you get home, all your responsibilities there. Keeping up with technology and the updates that technology requires. Keeping up with your different nursing practices and education and CE, environmental health issues like climate change and severe weather, the electronic health record, absorbing other people's duties as assigned. Racism, lack of equity, sexism, a lack of respect regarding the work that we do and the sacrifices that we make, especially with our own time and our own health and our own well-being. Of course, patient death, facing serious illness and angry and grieving families. And the physical aspect too, fatigue from long hours, the lifting, the twisting your body in strange fashions, handling patients, standing for long periods of time, and the moral and ethical stressors. So all of these build up and take a toll on the physical and our mental health, particularly if we don't take enough time and we're not allowed to take enough time to regroup and energize and rest. And if we are allowed those things, we have to utilize them, and our employers must allow us to use them. So employers and nurse managers need to work with nurses to ensure that adequate time is allowed for breaks, time off like vacation, and enough hours between shifts. Reasonable patient loads and optimal staffing are key. There is no nurse well-being without adequate staffing. We're going to go through a lot of things today, and this is not about nurse staffing, but I don't want to ignore the elephant in the room. And I do want to recognize that nurse staffing is key to a lot, if not most of this. Stress reduction and mental health resources need to be offered by our employers, and they've got to be relevant, confidential, easy to use and access, preferably free, but at least low cost, and well publicized. And in a perfect world, our nurse leaders will use them and encourage them to be used as well publicly if they are comfortable doing so. So saying, I use this method, I am comfortable doing it, it's really helped me. Why don't you, try it if it's something that you feel would be beneficial to you. And we as nurses must be aware of our own stress levels and our mental well-being. And we can do that via assessments, talking with other nurses, talking with healthcare professionals, talking with trusted loved ones, and other tools, and getting any help that is needed. Again, in a perfect world or in an ideal situation prior to an actual crisis.
Thank you. It's a lot. It's like when you hear the list, right? It's like
Yes.
And we as
That's
nurses,
it.
that's it. But that's like all in a regular, quote unquote, regular day. So you spoke a little bit about, encouraging management to try these resources. Do you have like any specific resources or programs that you could kind of share with us, as well as we'll share these resources after in like a follow-up email. But yeah, anything that we could as nurses utilize to help with our well-being.
Sure. I will start, since I work for ANA, I'll start out with two really great resources that ANA Enterprises offers, which are free and open to all nurses, whether you're an ANA member or not. So they're not behind a pay firewall. So anyone can access this. And if for some reason you can't get to it in the chat or the Q&A, because I did try to go ahead and list everything, I believe Lisa and Carly will be sharing with everyone some of the important links afterwards. So our first is Healthy Nurse, Healthy Nation. It's a free online nurse wellness program. It's available at hnhn.org. And as we get further in our webinar today, we will actually be discussing that in more detail. So I don't mean to leave you hanging and just give you that little bit of information. The second resource is our Wellbeing Initiative, which was launched by the American Nurses Foundation. Again, free, open to everyone. And it offers free tools and apps that support the mental health and well-being of all nurses. And the programs are completely anonymous. Some, but other resources include a stress self-assessment. This is something that you can complete on your own time. It's anonymous and helps you measure your stress and learn about the resources that are out there to help you. Happy is an app that you can, I guess it's more of like a warm line where you can confidentially speak with a supportive listener. Again, free. MoodFit app. This is an app that offers all kinds of things, but some of their more interesting offerings are being able to journal, access different breathing exercises, and much more. Vitalize is a brand new free app that they just have started using. Again, offering the journaling, mindfulness content, but even more exciting, some coaching and then nurse text groups that you can participate in. So you can join a community. And then they really do a lot of focus on gratitude. There's so much research and study behind the practice of gratitude. And it gets a bad rap. A lot of times nurses are like, well, what am I supposed to be grateful for? You know, short shifts, that big list you started the program with, Holly. It's not about that. It's seeking and finding things that are positive in our life. That one patient that does really see you and appreciate you. And also receiving gratitude when someone really sincerely thanks you, soaking it up like a sponge and receiving that gratitude. But they do have this huge gratitude toolkit and a great podcast mini series. So I would certainly encourage all of you to take a peek at that. Hopefully yesterday you all attended. I know I did the CDC's NIOSH's Healthcare Worker Wellbeing Campaign briefing session. I know that's a mouthful. Sorry about that. So during the session, they did share some resources that might be really helpful. I thought they were fairly amazing, especially since NIOSH often has things that are like for all workers, but this was really designated and structured toward healthcare workers. So they have a whole center for supportive leadership, because something that they've been hearing, and we've been hearing in nursing too, is they especially want training for managers. There is a worker well-being questionnaire. So we had talked about assessing where you are in your mental well-being. They have a great toolkit from the Dr. Lorna Breen Foundation. They talk a lot about the CDC NIOSH's wellness program, which is Total Worker Health. A lot of great resources. Again, a lot of these are for all employers, not just necessarily healthcare employers. Tips for leadership storytelling. And that's something that we're really hearing a lot about. People want to hear other people's stories and their, success and any challenges that they faced, but especially with leadership. Nurses have a lot to overcome with normalizing mental health and overcoming that stigma that's associated with it. And sometimes our board of nursing doesn't help with that. A lot of times intrusive questions are asked. So this is about seeking the help that you need. And if your employer's leadership can speak about it, that people feel more comfortable accessing those types of resources, which you'll find is a common theme we talk about again and again. There is a great webinar. Well, I'm assuming it's great. Hoping that it's great. That's coming out on October 31st from 1 to 2, and that you'll get the link on that. And that's entitled Overcoming Burnout and Building a Health System Where Workers Thrive. So that's through US News. So that'll be an interesting webinar to see. And then there's also an article that they have published, Suicide Risks of Healthcare Workers in the US. So another great article for everyone, but especially nurse leaders.
Thank you. So I've been hearing a lot as well. I've been to a couple conferences recently, and the theme of storytelling. That we've even for qualitative data, right? Like collecting that, getting away from just it being a number, and storytelling. When you get a group of people together and people realize that they're not alone, none of us are alone, whether our situation might be unique for ourselves, but as the whole, we're all kind of going through this together. And I really love that, the idea of bringing storytelling back. Thank you for sharing that. And then the journaling and breath awareness, knowing what that, where that shows up, anxiety, and how we can move through it with our breath. It's a practical skill that we can do anywhere. So thank you for sharing that. You spoke about suicide, and so I do want to discuss that a little bit further. As the suicide rates continue to increase in our country, the nursing profession, we're not exempt from this concerning trend. And I guess we've discussed already what are some of the contributing factors, but what measures or programs are currently in place to tackle or mitigate this troubling and specific issue within the nursing community around suicide prevention, awareness?
Absolutely. I do just want to say that I do want to issue a trigger warning to anyone that might want to mute or doesn't feel comfortable about listening to this at this point. I certainly will not be telling any stories at this point, but I do want to make sure that people have the resources that they're interested in. And I also did want to mention something that we didn't talk about, contributing factors, is that some nurses do suffer from substance use disorder, and that as nurses, we often have access to narcotics that other individuals do not. And we do know that nurses are a much higher suicide rate risk than the average US citizen. So programs and resources. Immediate assistance. So if you or someone you care deeply about has an issue and needs immediate assistance, please call or text 988. This is the Suicide and Crisis Lifeline, and it is available at all times. They also want it to be known that you do not have to be suicidal, actively suicidal at the time to call. If you just feel in crisis and you need assistance, please do so. You can also call 911, and you can also contact your healthcare provider immediately. Don't wait. If you do need the assistance, you feel in crisis, get it taken care of immediately. We will also be sharing some clinician-friendly hotlines in the United States. One is Safe Call Now. It's a crisis referral service for public safety employees, emergency services personnel, and their families. So again, that's Safe Call Now, and it's 206-459-3020. And there's a disaster distress helpline. And this is run by SAMHSA, the Substance Abuse and Mental Health Services. It's a 24/7, 365-day-a-year national hotline. It provides crisis counseling for those in emotional distress caused by natural or human-caused disasters. And again, that's the Disaster Distress Helpline. That's 1-800-985-5990. Last but not least is the crisis text line. Again, 24/7 crisis support from trained crisis responders. In the United States, text HOME in all caps, HOME, to 741-741. And again, that's the crisis text line. We'd also want you to remember that depression is treatable. You are not alone. So make the call, and make the call now. And also, I would like for you to know about our nurse suicide prevention and resilience web pages that the ANA has. We put them together right as COVID was rolling along. So during 2020, we had over 50 nurses, including some of the foremost nurse suicide researchers in the world, including Dr. Judy Davidson, and then also Dr. Bern Melnick, also co-chaired, who is well known, again, internationally for her work in nurse resilience. So in addition to them, 48 plus other experts and subject matter experts really helped us put together very robust, comprehensive web pages. And it covers everything about the state of nurse suicide statistics right now, classic nurse suicide prevention techniques, particularly focusing on nurses in crisis. There's a particularly excellent series about that are actual videos of what nurses can say to those who are in crisis in various situations that were put together by the Ohio State University. There's a section there, if the worst does happen, that covers bereavement and grieving, especially on the unit. You know, a beautiful soul was lost and you want to honor that memory. So it does talk about that. And then many, many people survive a suicide attempt. So we have a nice section there too for suicide attempt survivors, helping them, giving them some resources about whether they should return to work, if they're ready, what kind of plans should be in place, but also what their colleagues, HR, and their nurse managers should know as well, things to say and what not to say. So it's really a robust information. And of course, I don't have the link for this, but NAMI, the National Alliance of Mental is another great resource. So I definitely wanted to put that out there as well.
Thank you. That's a wealth of resources. So thank you so much for sharing those. So I want to include nursing students in this question as well. So looking at it from, the lens of, nurses that are future, right? That are still in school now, as well as nurses presently working. How can they advocate at their place of business, or at whether it's a hospital, a clinic, an office, or at their university or college, for their own mental well-being and promote a healthier work environment for their colleagues? Like, have you any great examples that you're seeing now in facilities or?
Well, one of the most important things is to find out what is already available at your place of work or your college. The thing with great programs is if no one knows about them or uses them, they go nowhere. So a lot of times you'll find you have amazing resources that you had no idea about. For instance, I hope it was eye-opening to find out you have all these free apps that any nurse can access just by going to the Wellbeing Initiative. But so look into your insurance. If you're in college, maybe your parents' insurance, see what's offered. If you're working, your EAP, your Employee Assistance Program, your college or university, and even the School of Nursing, as you kind of go further down, what exactly is offered and what's available there. If you look there and you don't see what you think is needed or more is wanted, this is the time to speak with your supervisor, your employee health designee, the HR department, your student wellness department, or the dean of nursing. So any of these people, if you see a need that is not being met, this is the time to speak to them. Another thing that you can do is find out what your professional association is doing. If you're a member of INCA, obviously you'd want to see what they're doing and see how you can be a part of that advocacy effort. If you're a student and hopefully you belong to the National Student Nurses Association or a local nursing club, that you can find out what's doing and you can be a part of that. And then join your employers or your school's wellness committee. And if they don't have one, maybe you could be that guiding light to start that wellness committee. I'm not making light of it because it is a big lift. The first thing you want to do is find somebody like the dean of nursing or the CNO. You need a champion that sits pretty high up. So I'm not making light of that, but you'll find like-minded nurses, just like we started today's webinar with that. I love that. And that you'll find others that really want to work together and start a wellness committee. Especially nurses, how you can advocate for yourself is that you need to work with your supervisor and your team to take your breaks and get your time off. That's just so basic. You need to be able to take your bio break for the bathroom. You want to stay well hydrated. What goes in must come out. So you got to have that bathroom break, and your meals. Definitely a 12-hour shift, especially. It's not the time to do your fasting. You still need to take the time to eat a little something and energize. The other breaks that are really important to take is when something really stressful happens on the unit, or even as a student, if something happens during your practicum. Someone goes through a crisis or code is called, or maybe a family member broke down really bad. You need to be able to take some breaks and walk away. And you can be the example. You can be the role model. In no way should you abandon your patient or your responsibilities, but take it appropriately, and others will see what you're doing and they'll be like, oh, if she or he can do it, I can do it too. So especially if you're in a supervisory position, that becomes really important. The other thing that I would say, especially for nursing students, when you graduate and before you take a job, see what the work culture is like. Do the people value their employees? Do the employees seem happy? See if you can speak to someone. Were they able to take a break? Did they take their dinner break? Do they like their benefits? Do they feel valued? So all of those things are super important before taking a job. So know that you don't have to put up with improper treatment. You are a person, and you're doing a wonderful, wonderful job, career, and calling, but it's not time to be a doormat either. So I just kind of wanted to get that out there.
I appreciate you saying that, because it's a great reminder for us, like, and it's empowering, right? We need to, I would never have thought to like ask people that are working where I want to work, right? And of course, like when you take a tour of the unit, like look around, ask people, notice those nonverbal cues that we as nurses are trained to see as well. Thank you. So now let's shift over to the Healthy Nurse, Healthy Nation initiative. What is this? Can you provide us with an overview? What it's like, its mission?
Oh, sure. So Healthy Nurse, Healthy Nation is a free nurse health, safety, and wellness program. It's open to everyone, and it's available at hnhn.org. When I say it's open to everyone, that means LPNs, nursing students. Even though it's geared towards nurses, the hospital security guard, the respiratory therapist, anyone can participate. It's geared, most of the information will be helpful to anyone in healthcare, but especially nurses. Obviously, it's geared towards nurses, but once you peruse what we offer, you'll see that a lot of people can get something out of it as well. So our mission is to improve the nation's health, one nurse at a time. And we focus on 6 domains: physical activity, nutrition, rest, which also includes taking your breaks and time off, mental health, quality of life, which is kind of like a nebulous category, everything from work-life balance to physical health, and then safety. And mostly it's occupational health safety. So workplace violence, incivility, and bullying prevention, say patient handling and mobility, preventing needle sticks, that kind of thing.
Wonderful. And what strategies or tools are available to help nurses assess and improve their health through the Healthy Nurse Healthy, which you just kind of touched on? And so is it just kind of going on a website? Is there an app?
Sure. So just a little more preface. Our tagline is to inspire, empower, and move. So we really want nurses to become role models, advocates, and educators of wellness and well-being for their patients, families, coworkers, communities, but ultimately, and most importantly, for themselves. Healthy nurses are more credible when educating patients, and when they're operating at their peak, they're able to offer their best care. So the premium experience, although all experiences are free, offers an online platform. And but we're also available on social media. We realize some people don't want to join one more thing. So we do have a private Facebook group, and we're also on Instagram, and I think you call it X now. And then we also know some people just want to participate in our monthly challenges. So we have text opportunities, and I will talk about that. So all of this is basically for nurses to improve their own well-being, but also to work with their employers, their schools of nursing, their professional organizations, and others to support each other, to engage in friendly competition, to share resources, and most importantly, just to connect with each other. We offer a comprehensive health survey. Currently, it's over 101 questions. You get your results immediately in a heat map. Like green means you're low to no risk, yellow medium risk, red high risk, gray means you skipped it or it was not applicable. And you can take it year after year and track your results. So that's kind of a neat thing. We do offer monthly challenges, everything that you can imagine. We've done gratitude challenges, resilience challenges, eating green, eating for a healthier planet, building your core strength, just anything that you can imagine that would make sense with nurse health, safety, and wellness. We've even done anti-bullying challenges. So just a little something for everyone. We do have discussion boards. We have contests on occasion. We talked about storytelling, and one of our most popular offerings is we have individual nurse wellness spotlights, which Lisa, you might know something about. We will be spotlighting Lisa in the near future, and we're looking forward to that. And the cool thing about that is it's not always what you think it is. You know, we have plenty of stories of nurses losing tremendous amounts of weight or running their first marathon at not the typical age you would expect. But it's also about like things like learning to say no more, not texting while you're driving. I always, with the storytelling, I mean, I think past of all the sermons that I've ever heard and all the lectures that I've ever heard, the ones I remember that stick with me are the personal stories. And you're like, oh yeah, I like that one. You might forget the facts and figures and all that kind of stuff, but you don't forget the personal stories. And sometimes that helps you remember someone for the rest of your life. So I really love and treasure those. I work with those people, so I feel like I know each and every one fairly well. And when we do the same for organizations, organizations can join Healthy Nurse, Healthy Nation. And of course, Inca has. Excellent. And we have a spotlight on them as well. So this is a time that we can really write up what your organization is doing well for health, safety, or wellness. And we do it for hospitals, hospital systems, nurses associations, schools of nursing, and even universities as a whole. And it's so interesting to see what other people do. So I'd encourage you to look at those champion spotlights because someone did it there. Organization, and odds are you could probably do it at yours too. And if you reach out to me, a lot of times I can connect you with the people that actually made that happen, and they are often very willing to share their story with you and see how you can replicate their success. Every month we put out at least 2 or 3 blogs, and again, they can be on anything. We do ask you if you would like to write a blog, if you're a subject matter expert on something, to reach out to me. We would love to have that. And then we also have a blog content calendar. So sometimes I might reach out to you to see if you're a subject matter expert and if we could interview, and the blog would be written for you, but with your quotes and with your final go ahead. We do have a commitment board too. It's almost like a resolution board. So research shows when you put something in writing, you're more likely to follow through with it. We have other opportunities like giveaways, virtual coffee breaks, and Tai Chi events. And our private Facebook group is very active, Healthy Nurse, Healthy Nation. That's an easy lift for anyone if you're on Facebook. It is a moderated group, so you do have to ask permission, and the moderator should let you in pretty quickly. And then if you want to join our challenges, all you have to do is text Healthy Nurse, all one word, to 52886. That's text Healthy Nurse, all one word, to 52886.
Thank you. I'm writing that down right now. So you brought up how you collaborate, like you touched on a little bit how you collaborate with like healthcare institutions, employers, and professional organizations to like spotlight what they are doing. And is that you finding them, or are they reaching out to you, or as a nurse, like how does that happen? I guess, or even for the Healthy Nurse, Healthy Nation, how are you finding the facility or the person to spotlight?
So the answer is yes. I meet amazing nurses all day, every day. And I often ask them, can we spotlight you? You're so amazing. But I'm also blessed in that we do put a call out for nurses as well. So you can nominate yourself, or you can nominate another nurse you know. The only the only requirement is that they are a nurse or a nursing student. And you just reach out to me at holly.carpenter@ana.org. So Holly's like Christmas and Carpenter's like the profession. So no weird spellings to my knowledge. So I would definitely ask you all to reach out. We actually have a surplus right now of of hashtag Healthy Nurse Spotlights, but we're always looking for the next one. We're well into 2024 before yours might show up if you're nominated, or if you nominate yourself, but we still want to hear from you. And then the same with your organization. The only requirement is that your organization has joined Healthy Nurse Healthy Nation. And again, it's basically filling out a form. There's no money involved at all. Everything is free. And when you join, your organization joins, again, this can be your school, your organization, your employer. We're happy to highlight and spotlight your organization. And we have some great stories already out there. It's a great way to share your policies and stories, and then hook up with other organizations to see what they're doing and if you can replicate their success. Some of our great champions serve on Healthy Nurse Healthy Nation's advisory committee. A lot of times I might tap you on the shoulder and ask if you could be a subject matter expert for a blog or author an article for the American Nurse Journal. We like to publicize your stories too on social media. And then if you do join, if your organization joins and more than 25 or more people take the survey and affiliate, show that they work for or affiliated with you in some way. Once 25 people join and do that, we can generate reports from our Healthy Nurse survey, and they're de-identified and aggregated. It is an IRB reviewed study, and confidentiality is key. That's why it has to be 25 or more people. So those are some of the benefits that you can get, and how we work with the professional organizations and employers.
I love it. So it's like we have all these nurses and organizations working to improve the well-being of nurses, and Healthy Nurse Healthy Nations is helping connect us all. So thank you for that. Any upcoming events or webinars that we should keep our eye out for Healthy Nurse Healthy Nation?
Sure. Our next challenge is called Upcycling Your Pantry, sponsored by Compass One. So this is neat. I mean, all of us have this food we've kind of pushed to the back of our pantry or in our fridge. And we will actually have really cool tips about how to recycle that food into something healthy, get it out of your pantry, and then give you some new healthy recipes to use it. But then also some shopping tips. It helps you save money. It protects the environment. It's like win-win-win. So I am going to also have a session in Inca's upcoming 2024 conference. I'm super excited about that. And then we'll really get into some of the stories and spotlights of the nurse, the individual nurse. I'm really looking forward to that. I love sharing the stories. That's one of my favorite parts. I'll be in Chattanooga, Tennessee this Saturday. I feel like a comedian kind of hawking their wares. So if you're going to the Tennessee Nurses Association's membership assembly and conference, please stay for Saturday. I'll be there giving out awards and talking more about Healthy Nurse Healthy Nation. Sigma has their Creating Healthy Work Environments conference in DC. I don't know the exact date in March, but it's in March of this year. We will be there, and my director, Katie Boston Leary, will be speaking, and we'll have a booth. And then annually, we always are at the ANCC joint conferences of Magnet and Pathway to Excellence. Sometimes we have a presentation, sometimes we don't, but we always have a booth. We always have Tai Chi, and generally we usually also have a teaching kitchen, so that you can learn how to make some healthy, quick and easy food that hopefully your family and you will enjoy. So those are some of our upcoming events.
Yeah, wow. Thank you for sharing that. This has been wonderful. It's really great to connect with you and just hear about everything that is being offered, because I think sometimes we feel alone, right? Like you had brought up the stigma with mental health. And as nurses, we are fixers, we're caregivers. We tend to put out all this energy first before, filling our own cup up. So the stuff that you at Healthy Nurse Healthy Nation are offering, and ANA and all the other lovely resources that you offered, it's just really empowering and inspiring to know that we can turn somewhere. There's somewhere that we can go. So thank you. Before I invite Carly back, though, there's like one final question, kind of like a surprise question we ask our guests. What is one dream or hope that you have for the future of nurses or nursing?
That is a surprise. It's going to be a big one. So
that's good.
This is embarrassing. Well, I guess it's not embarrassing. Old age is a blessing, not a curse. I have to remind myself that. Not everyone gets to see old age. So I graduated in '86, and staffing was such a problem back then. And so like we had not really learned about HIV/AIDS in our nursing school, and the most we had ever had was 4 patients to take care of. And then we were set loose in the world and we're taking care of HIV/AIDS patients where we didn't really know that much about that disease. We were taking care of 10 to 20 patients on our load, and it was just very overwhelming. Well, flash forward, that's '86, not quite 40 years, but we'll say 35 years. We're still seeing those kind of same problems. You know, nurses felt very ill-equipped at times to deal with COVID, the very short staffing and things of that nature. So my dream would be that we can stop that cycle. We will not ever not be able to have unexpected diseases and things of that nature, but it'd be wonderful for the staffing issues to be resolved. And that's a huge, huge ask, but that would be a dream, that nurses actually have proper staffing so that if mental health programs are offered, they have backfill so they can leave the unit and know that their patients will be well taken care of, that they can go to that 15-minute or 30-minute yoga session that's being offered for nurses. I think that would be amazing if you had enough staffing where nurses could eat their meals, go to the bathroom, take advantage of what's being offered at their organization and leave. And the biggest dream is that you're more healthy for having gone into work that day than if you had stayed at home, that you had great food, that you had great camaraderie, that you worked for someone, a worker that an employer that appreciated you. You worked with patients who obviously don't have to be perfect, and they can be sad and grieve and angry at times, but at the heart of it all, know that you are there for them and that they appreciate you. So that huge dream of like Miss America, you know, world peace. So yeah, it's a big
beautiful
ask,
dream. Hey, we gotta plant the seed, right? That's the intention. Well, thank you so much. It has been such a pleasure to chat with you. And Carly will be back to go through the Q&A, and I will see you soon for sure in April. So thank you again, Holly.
Thank you, Lisa. This is a pleasure.
Hi, Holly. Oh, your dream is just wonderful, and we appreciate all the hard work you are doing right now to make that dream come true. So let's go to the Q&A. Okay, someone said, "Hi, Holly. I am an assistant nurse manager for a large department. I moved from bedside ICU to leadership after the first year of the pandemic. Many of my leader colleagues have said this is the hardest time in their entire leadership career. I support 110 to 120 nurses and LNAs and have a really hard time seeing and supporting everyone on my team. It seems like in every other industry that work teams are much smaller, maybe 15 to 20 people. 110 people or person teams feels impossible." And then somebody else said, "We are amidst a large expansion at my organization with changing minds, changing lives. It's an amazing group-based program that uses both writing together and sharing stories with each other. We met today and it was so powerful to hear nurses reflect on their experiences. Have you heard of this program yet?"
I have not, but it sounds wonderful. Can you tell me it again so that I can Google it? Changing hearts?
Changing minds, changing lives.
Changing lives.
Yeah, it does sound like a good one.
I do appreciate that. And the lady that has the large or gentleman, I don't remember. I don't think a name was given.
But
Yeah,
the
my
first
heart
one,
goes out to you. That's a difficult one. I don't know if you were asking for any advice or for resources, but the whole nurse manager thing I have brought to the Wellbeing Initiative to challenge them to see if they can find some resources that will really assist nurse managers. We always say about PTSD, the soldiers do not have issues necessarily in the battlefield. It's when they come home and quote unquote everything's somewhat gone back to normal. So we do have to be vigilant and really keep a special eye on all of our all staff members and our colleagues. We really have to look out for each other, and it is difficult. I would definitely say work with your human resources department and ask them what kind of resources they are looking at for you that will help you be your best manager self. And some of that might be them hiring some more managers that will assist you. So you can at least be a triumvirate or have some serious assistant directors that can assist with such a heavy lift.
yes, that's great. The next one, is there any research you are aware of regarding passive SI transitioning into active SI? I know passive SI is something I recently began hearing about and something not discussed as much.
I will be honest, I do not know about that research. I did write it down. I can we do have a researcher on our team, Allison Kucha. I can ask her. And then we are blessed that we work with Dr. Byrne Melnick quite a bit, and she may obviously know more. Sometimes I like to joke that I don't know anything, but I do know people that know. I know people that know things. So I can hopefully find out more about that. And if there are notes or something that goes back to this, hopefully I can get that to you. But I will ask Dr. Melnick about that, and Allison Kucha.
Great. Oh, is ANA utilizing the role of nurse coaches to support mental health of our fellow nurses?
So Healthy Nurse, Healthy Nation has a very large constituency of nurse coaches. You'll see that quite a few of our spotlights do have nurse coaches. When you go on our Facebook, our private Facebook group, you'll see that there's some phenomenal nurse coaches on there that actually work as, I guess, have their own side business. I don't know if that's the right word, but then they also work in the hospital as well as a bedside nurse, not as a nurse coach. And I think some work as a nurse coach in the hospital as well. So pretty much that is what we are doing at this point with nurse coaches. We are spotlighting them. We have on and off throughout the years worked with Inca quite a bit. In fact, I hope I'm saying her name right. It's been years. Barbie Dossi.
Mm-hmm. You got it.
She was one of the first people that helped us put together Healthy Nurse, Healthy Nation. She was one of the OG, so to speak, the old guard, putting together Healthy Nurse, Healthy Nation. So you have always been a part of it, and hopefully you will see their footsteps that went before and that continue now. So thank you for that question.
Yeah. Oh, and somebody else asked about the same thing too. So that's great. Where are the gaps in support for mental health for nursing locally and nationally?
One of the biggest problems, it's just so many different levels and so many tiers. So please forgive me if I'm not really answering your question. I'm not trying to sidestep it. A lot of people are afraid to get help because of, I think it's 30 some states in the US ask intrusive mental health questions. So sometimes people feel like they either can't get the help they need because they might put their license in jeopardy, or because they don't want to not be truthful. It just puts them in a very awkward and bad position. So that is one thing. The other thing is that mental health assistance has to be offered by big healthcare employers. And I would like to think small healthcare employers too, at least through health insurance. But it's got to be accessible. It can't be, 2 hours from here, you can go see someone if you really want it to be confidential. And it does have to be confidential. If you're working in a psychiatric facility, you do not want to be treated by your colleagues. You need to have something else that is out there. So that's really a challenge to the employers to find confidential but easy to access, affordable mental health. And those assessments should be easy to use too. A lot of times you don't know how bad it is for you till you are in crisis, and it's better to be prepared and know, what, maybe I need to see my healthcare provider, maybe I need to see a counselor, maybe I need to take some time off. I just absolutely have to for my mental health, that kind of thing. So
wonderful. Well, that concludes our webinar. Thank you so much, Holly, for taking the time to be with us today. And again, thank you so much for all the work that you're doing for nurses' health and well-being. We just appreciate you beyond words. And of course, thank you to all the nurses who came on to listen tonight. And if you would, like Holly already told us, but if you would like to see Holly again, consider coming to INCA's first conference, the Integrative Nurse Coach Symposium in Miami, Florida, this April. Holly will be presenting along with a variety of other expert speakers. And you can find more info and register at inursecoach.com/symposium. And please, of course, reach out to us with any questions that you have. And always, thanks for gathering.